Assalamu alaikum wa rahmatullahi wa barakatuh. This is your brother, Dr. AbuEesa, aka the Muslim Shrink. I just wanted to make a brief video in response to Dr. Jalaluddeen's false claims about the Prophet ﷺ, having epilepsy and experiencing hallucinations. From my understanding of watching his videos briefly, and to be honest, I haven't wasted my time because clearly he doesn't have a clue what he's talking about. But I'm just, I reviewed akhee Farid's video entitled, "Now They'll Say the Sahaba Had Epilepsy." And I wanted to clarify a few things because there are false information that is being promoted. So let's define what epilepsy is first. And I don't want this to be a technical kind of conversation. So I'll try and make it as simple as possible. So essentially, epilepsy is a common condition that affects the brain and causes frequent seizures. And in terms of, symptoms of epilepsy, seizures affect people in different ways depending on which part of the brain is involved. And possible symptoms include uncontrollable jerking and shaking, which is typically called a fit, losing awareness and staring blankly into space, becoming stiff, having strange sensations such as a rising feeling in the tummy, unusual smells or tastes, and a tingling feeling in your arms or legs, and collapsing. So essentially, there's different types of epileptic seizures. I'm not going to go into that today because that's not really the point. Now, in terms of how common are hallucinations in patients who are epileptic, the literature suggests that most commonly psychotic symptoms are associated with something called temporal lobe epilepsy. So if the temporal lobe is involved, that is usually when psychotic symptoms may appear. And it's so psychosis in people with epilepsy is most often classified according to the time when the episodes occur in relation to seizures. So post-ictal psychosis has been estimated, according to the literature, to affect between 6 and 10% of people with epilepsy. So I guess in summary, the point is that epileptic patients don't usually have psychotic symptoms, okay? So this is Dr. Jalaluddeen is conflating epilepsy with a rare form of epilepsy in which psychotic symptoms may occur. And when they do occur, they usually occur interictally, during the seizure or after a seizure. Okay, let's move on to auditory hallucinations. What exactly are they? There's a wide variety of definitions, but essentially, when you lose sense of reality, you can experience different types of hallucinations, including visual, including auditory, olfactory, etc. So auditory hallucinations are not typically seen in epileptic patients. They're more typically seen in psychotic states, which may be due to schizophrenia, maybe due to drug-induced psychosis. Although they can be brief psychotic episodes, it's unusual for somebody to function normally and then have kind of discrete psychotic experiences, which Dr. Jalaluddeen seems to be implying. So that goes against the evidence, and certainly the Prophet ﷺ, if you look at the seerah, there's no descriptions of him having long periods of unstable mental states. So again, Dr. Jalaluddeen, with due respect, has no idea what he's talking about. In his video, which akhee Farid referenced, he also talks about personality change and antisocial behavior. Again, this just confirms to me this guy has no clue what he's talking about. So personality disorder is quite a controversial topic within mental health. There's a lot of psychiatrists and mental health professionals who don't actually believe that this exists, although it is in the classificatory systems of DSM and ICD-10. And essentially, these are disorders characterized by personality vulnerabilities, which cause impairment in some sort of functioning, whether that's home life, occupational life, social life. So again, I don't know why he brought in this personality change and antisocial behavior just trying to misguide people without having the correct understanding of basic psychiatry. He references the Prophet ﷺ being deluded. So a delusion is essentially a strongly held belief which goes against the evidence and against the kind of cultural and religious context. Where's the evidence? He's making this claim, and clearly he hasn't got a clue. So example of a delusion, a paranoid delusion, would be patients who have a psychotic illness. For example, schizophrenia. They may be convinced that they're being watched by aliens, and the aliens are trying to hurt them, or punish them, or there are cameras in their house and they're being watched by external agencies. So that would be a delusion, and it would affect somebody's ability to function in society. Hearing voices, where's the evidence? He claims that, the Prophet ﷺ heard the tree or a rock saying salam to him. That itself does not equate to a psychotic illness. And as Muslims, we believe that the Prophet ﷺ was given supernatural experiences, for example, Isra wal Miraj. So for us as Muslims, this is nothing. It's just a small thing. If he heard creation, whether that be trees, stones, giving him salam, sallallahu alayhi wasallam. And Akhee Farid made a very good point, talking about shared experiences. So the Sahaba, many of the Sahaba heard these things that the Prophet ﷺ heard. So unless they have something called folia do, which is shared kind of psychotic experiences, which I'm sure he can't claim based on tarikh, based on history. Again, he's talking rubbish. The other point I wanted to make is usually people who have hallucinations, whether that be auditory, visual, may also tend to have other features. So if for a diagnosis of schizophrenia, you have something called Schneider's first-rank symptoms. You have to meet those criteria to be diagnosed. And they include, for example, thought insertion, where the person feels that somebody's inserting thoughts into their mind. Thought withdrawal, where thoughts can be taken out, and thought broadcast, where the thoughts are being broadcast and other people can hear their thoughts. Then there's something, passivity phenomena, and I'm not going to bore you with the technical terms, but generally speaking, people who are hallucinating tend to be thought disordered, so they will not be coherent in their conversations. They tend to, not be able to function, and that's why they need psychiatric treatment and therapy. So I would ask the question, how did the Prophet ﷺ, if this is the claim, how was he able to produce the linguistic miracle of the Quran? I've been treating psychotic patients for years, and I've yet to see somebody who's acutely psychotic or even has chronic negative symptoms of a psychotic illness, such as schizophrenia, be able to produce, something of that quality and standard. Obviously, nobody can produce that quality in terms of comparing to the Quran. But the point is that they will not be able to, function to a level of intelligence that would permit them to produce high-level, high-quality work. So the last point I think I already mentioned is a subset of epilepsies called temporal lobe epilepsy, which is what is usually associated with some sort of psychotic symptoms. I hope that clears things up. Like I said, Dr. Jalaludeeeen, Gondal, whatever his name is, he's got absolutely no Danny's, I'm sorry to use the British slang there, about what he's talking about. And I'm happy to be challenged by him. It's unfortunately an area, mental health, where people are not as clued up as with physical health issues, so people can just peddle any nonsense that they want. And just, I guess, advice to Akhee Farid and clarification that don't equate epilepsy with psychotic symptoms or hallucinations. So epilepsy is traditionally not associated with hallucinations. So Just because somebody has epilepsy, they're not very likely to have psychotic symptoms. I hope that that was helpful. Inshallah, may Allah subhanahu wa ta'ala reward you, Akhi Farid, and all other Muslims who are standing up for the deen. I'm trying to do my bit. I'm sorry, this is something new for me to produce videos, so the quality might not be that great. But anyway, inshallah, may Allah subhanahu wa ta'ala keep us on the sirat al-mustaqim and keep up the good work. Assalamu alaikum wa rahmatullahi wa barakatuh.